Well, welcome back to Medical Mondays here on News Channel 5 Plus. I'm Casey Mason, and joining us all tonight during this segment is Dr. Vincent. Thank you so much for being here tonight.
Thank you.
We really talked about a lot of topics. If you're just tuning in, we're talking about skin cancer awareness, and again, I've already mentioned this a few times throughout the show, but skin cancer is the most common of all human cancers, and that's just really, it strikes me. I did not know that before tonight. I knew we'd learn something.
Yes.
All right, well, we are going to go ahead to our phone lines. We have a caller in tonight. His name is Carl. Carl, thanks so much for joining us. He's going to tell us his tanning bed testimony, as I like to call it. So, Carl, you're on air tonight. Thanks for joining us.
Hello, can you hear me all right?
We can hear you just fine, Carl. We appreciate it. So, when you called in, you do have a few things you want to share with us about tonight.
Yeah, I got hooked. Y'all talked about the addiction. I kind of got hooked on the tanning bed there a couple days a week back in the 90s, and it just progressed. And I never thought it was a big deal. I'm looking all crispy all the time, and it ended up being one of the worst things I could ever have done. A spot popped up on my groinal area. Going into details, but it kind of spread, and I ended up losing a testicle.
Oh, that's so unfortunate. I mean, too, do you feel like calling in tonight, you can help other folks realize, just how strong would you say the addiction was to tanning?
Well, I'd feel bad when I didn't go. You know what I'm saying?
And tell me when you realized you needed to go seek help.
Well, I didn't think it was any big deal there for a while. It was just a spot. Then when it grew into a lump, it was already too big.
Yeah. Well, Carl, we do appreciate you calling in tonight, and of course, reaching out to others this evening. We want to hear from you, and also, that right there is a good example of an experience and a story. And I'm sure there's several folks that are watching tonight that have questions. Speaking with someone like Carl, I mean, it's kind of leading us into a segment we're going to approach here in just a little while, and that is tanning bed addiction, or even just sun addiction. I mean, it really feels great to have a tan, but in the grand scheme of things, it is not worth it, and we'll get into that in a moment. But right now, we're going to go ahead and take a look at that third type of skin cancer, and that, of course, is melanoma. I think everyone's familiar with this, and this is the one to look out for.
So this is an example of a normal mole, okay? So this is before we get into the discussion about melanoma. This is the type of mole that we want to see. It has an even border. It has an even color throughout. And there's not anything about that stands out as being a bit atypical. But if you move on to the next photo, there we have several pictures of actual melanoma skin cancers. Oh, here's the ABCDs.
Yeah.
Okay, so I love to talk to people about the ABCDs and E's of melanoma, because we talk about this so many times in my clinic on a daily basis. A stands for asymmetry. Okay, so that means if you were to divide your mole in half and one half does not look like the other half, it's asymmetrical, and that tends to be a little bit of a warning sign. B is for border. We always like to see a mole that has a very even border, like the mole we just saw. It does not have a jagged edge or a hazy edge, so if your mole is irregular, we don't like that. C is for color. We like moles to be very even in their color, like an even color of light brown or an even color of medium brown. We don't like various colors like brown and blue and red and in the same lesion. D is for diameter. If you have a large mole that's bigger than the size of a pencil eraser, that can be a little bit of a warning sign. However, I have seen many skin cancers that are smaller than that, so that you have to take that a little bit with a grain of salt. But E to me is the most important of the A, B, C, Ds, and E's, and that's evolution. If someone comes to my clinic and they have had a mole that they've had for 20 years that has always looked the same, and all of a sudden it starts changing colors, changing shapes, starts bleeding, starts itching, just something changes, that is a mole I want to see in the clinic. And it does not necessarily mean it's skin cancer, but it's just something that needs to be checked.
Yeah, again, I think it's important to note. It doesn't always mean that something is wrong. It's just good to have it looked at.
Absolutely.
In our next picture here, what are we seeing there?
So here we're getting into the melanoma picture, and you can see with this mole, is the border round and even? No. No. It's a little bit irregular. Is the color the same color all the way through? No. This mole has two colors, and you can see by the measurement, it's 1 centimeter, which is 1/2 inch, and that's bigger than a pencil eraser. So
Yes.
that lesion already meets 3 of those criteria, and so that lesion needs to be biopsied, and it was indeed a melanoma.
Yeah, it's so great. I mean, the things you're sharing with us tonight, this is free medical advice, and we're learning, I'm learning a lot. I know our viewers at home are, and I really think that these pictures are important to show because, it's different things to look at,
Right.
you know? So, and what are we seeing here now?
And so this is another example of a melanoma where you have a very uneven edge. It's not exactly round or oval, and you can even tell by looking at the picture that the texture is uneven. It looks like it has a pebbly texture to the surface.
Yeah, and like you said too, I think everybody has freckles, everybody has a little mole here and there. If you notice that change in something that
Right.
is,
Right.
that's when you know what you're looking for.
Here's another example where you can see in the center of this mole, it's a little hazy with the color a little gray. So the color is not even all the way through, and the border is irregular. So if someone had 50 freckles that all look the same and 1 lesion that looked like this, it would stand out. So you're always looking for lesions that don't fit into the picture for that particular person. Something that stands out, a lesion that does not look like their other lesions.
Now,
And
is
then
that
this
the bottom
is-
of a foot?
that's a heel.
Wow, I would not
So-
expect that.
Right, and to our point earlier, where
Yeah.
people say, oh, I've never had sun on my feet, I say you have if you've gone swimming, if you've laid out. I mean, there are situations where you get sun on your feet, and
I'm
the
a flip-flop
problem here,
wearer, and I think that's one right there.
Indeed.
Yeah.
And the problem here is that this person may have never turned their foot over and looked at the bottom of their foot.
Wow.
So that's another reason, to get a skin check, is because there's somebody reminding you, hey, look at the bottom of your feet.
And now I have to ask, that pictures, it's really, it's something to see. And
Yes.
as a doctor, when you do see that, what goes through your mind?
Well, I'm not ever happy to see it because I'm never happy to deliver that news to the patient of what I think they have. But that is a person, if they walked in the door, that we would immediately do a procedure that day. Like I would say, I would not feel comfortable with them leaving the clinic with that on the heel.
And how severe would that procedure be?
It's a difficult location being on the heel, but you would have to numb the area, and we would actually excise that, cut that lesion out so that the lab could look at the entire lesion.
And I just, looking at that and hearing what you just said, I think that's just another great example of why it's important to, just keep an eye on things. And, if you've never seen a dermatologist, now's a great time to start thinking about it. That's what I did a couple years ago. I didn't really have anything particular that I was going in for. I just wanted to get a checkup. It's no different than going to the dentist or the doctor.
That's right. It's a preventative measure. And I think, since half of melanomas develop from an existing mole that changes, it's very important to have those moles looked at on a regular basis, and half of moles will pop up brand new. So this is an example of a melanoma that from a color standpoint is not so ominous looking. It's not black, but you can see how irregular it is. For reference, on the top right hand side there is a regular mole, and then the lesion in the center of the screen is the melanoma. Probably an early one in its development. It could be that this person had come in and the lesion used to be round and even, but they've noticed that it started kind of seeping out on one side and having a jagged edge, so that's no longer round in its shape.
Okay. Yeah, and any other photos we have? I think that was the end of our photos, but those are so important to share, and it really proves that they come in all different shapes and sizes and there's a really lot of things that you're looking out for, but that's again where if you go see an expert, they can really, pinpoint what is a problem area and what isn't. So now this is the part that I've really been interested to talk to you about personally, and that is addiction to tanning. And this is a thing that really exists. I want to hear your thoughts on this. It's hard to believe. Really, I think you can get addicted to anything. It's, that's true. But when it comes to tanning, how would people become addicted to this?
Well, it has been studied. There truly is a tanning addiction, and I think Carl alluded to it, and I appreciate the phone call because that kind of brings the awareness to the forefront. Certainly, as you mentioned before, there can be addiction to sun in general, that people, like you said, it feels so good, and I was raised in a generation where the tan was the most important thing in your life, to get as dark as you possibly could. And so that was a problem in and of itself. The tanning beds have taken that a step further. I just have a lot of patients who come into my clinic and we do a skin check, and they may actually have a skin cancer, and then we remove the skin cancer and they go back to the tanning bed.
Wow.
They just cannot seem to give it up. They want that dark color to the skin. They don't really tend to see the changes that everyone else sees, the leathery appearance and that type of thing. They just see that their skin is tan, and they always want to have that tan.
I mean, it's no different than an addiction to cigarettes, alcohol.
Absolutely.
And I think there's a belief that no, tanning addiction, but it really, from a doctor's standpoint, it is a true thing. I mean, it definitely exists. And so, I mean, you know, we bring that up, but then what can folks do? What are some options if, you know someone that maybe really is abusing the sun?
Well, from personal experience, I've had several patients. We try to make that transition, you know, away from the tanning bed, and it might not be something that they can stop from one day to the next. I can counsel them to kind of, okay, could you, instead of going 3 times a week, can you go once a week, you know, and then try to start using self-tanners so that you still have the color, because a lot of people, the color of their skin is what the important thing is to them. So it's more of this mindset, the change of the mindset to get them away from doing, and it certainly can. For some people, unfortunately, they have to get a skin cancer before they wake up, you know, and really realize that that is causing that significant amount of damage to their skin. And unfortunately, some people have to kind of go through that to get there.
And even unfortunately, some folks still continue on. I mean, it is an addiction, just like we said. I mean, I think it's important to note that can occur. And, you know, that kind of brings me back to, as we're kind of wrapping tonight, I do want to go back into just really going over again what it's like to visit a doctor. Recap for us that experience, and, you know, let folks know, say they know someone that maybe needs to see a dermatologist, what the steps are and what that office visit is really like.
Well, some patients, they are coming into the clinic because a family member or a friend told them to come into the clinic, you know, so it may not be of their own accord, but someone suggested that they come in because they had a spot on their back and the person didn't know they did. So it's as simple as making a phone call to the office, scheduling an appointment, coming in. We ask patients to, you know, put on a gown. We just do a simple skin check. It's not a difficult process at all. It is not intimidating at all. And if patients have specific questions, they can ask. There are instruments that can be helpful in determining if a lesion is suspicious. There are handheld magnifying glasses called dermatoscopes. There are things like that that can help. But for the most part, if someone has something that's suspicious, we would probably go ahead and do a treatment in the office. And there are lesions that maybe have not yet become skin cancer but are pre-cancerous lesions, which tend to look similar to some of the pictures that we saw as far as being little rough scaly patches. From my personal experience, the first one I ever had was on my cheek, and I thought I just had a piece of dry skin, and I scratched it off and it went away, and then 2 weeks later it was back and I scratched it off, and after 3 or 4 recurrences I realized that, okay, that is a precancerous lesion. Those cells are dividing too rapidly, and so that lesion I treated with liquid nitrogen, which is a freezing technique. So not everything has to be addressed surgically. So sometimes if patients come in and we catch things early, we can do non-surgical treatments like freezing or creams. There are certain creams, or laser treatments. So there are lots of other options that are not quite as intimidating to the patient.
Yes, or intrusive, especially when you're dealing with your face. You know, I think that's a region that a lot of folks are kind of worried about. You know, it is right on your face, so you do worry about that. So that's good to know that there's other options that aren't quite as intrusive. So it still takes care of the situation. So again, we have Dr. Dawn Vincent of Bellamy Dermatology joining us tonight. Now we have a few more minutes left in our segment tonight, but we're going to go ahead and take a quick break, and we're going to wrap things up tonight. So we'll be right back.